Good morning. I'm Dr. Abdurrahman, your orthodontist today. Today we will introduce an important topic which have a lot of patients that complain from this problem, which is open bite from clinical aspect. You should put in mind before treating this case is that the importance of the diagnosis of these cases, and this lead to an correct treatment plan after that. Let's first. An open bite is very challenging case, but if treated well, you may change someone's life. Because this patient have an problem in the appearance of his or her smile. So when it treated well, you can change this person's life. So you should put in mind that the treatment of this open bite had an impact um, on the quality of the life of the person. Okay, away from academic presentation, how to deal with the open bite cases. Let's start with the first case. This patient come to your clinic complaining from this open gap that is present between front teeth, and there is spaces in the upper and lower teeth. So you decide to go for an extrusion of the upper incisors, upper and lower. After you get a lot of records, you discover that the patient has increased incisor show during smiling, so the extrusion of the upper incisors is not suitable for this case. After also gaining a lot of records and more records, the patient has proclined upper and lower incisors, so this case is indicated for extraction, and after extraction the open bite may be relieved. So it's very important to put in mind that we should wait and collect for records of the patient. You shouldn't build your treatment plan on a single photo or just clinical examination of the patient. You should have x-rays, showed extra oral photos, and all full records for the patient to put correct diagnosis and then correct treatment plan. So what do we need? We need correct treatment plan by the history of the habit and medical condition, and extra and intra oral photos, and lateral calf. Why history? We have two patients. This patient number one. This patient come to our clinic and complaining like this video, that the patient when struck to swallow, the patient push his tongue forward between the top and bottom teeth. So that is habit is called tongue thrust. So you should put in mind that the history of the patient is very important in the etiology of the case, because the patient has a tongue thrust may affect the stability of the case after that. The history is very, very important before starting the treatment. This is patient number two, and this patient, when we ask her mother about the way of respiration, she told that the patient breathe from her mouth and can't breathe from her nose. So you should put in mind that you should refer this patient to ENT specialist to confirm the patency of the nose and the airway pathway, to confirm this patency before start the treatment. And after that you can start the treatment correctly and correct this open bite after removing any cause or history that is present before our treatment. So the next question is why extraoral photos? So you can see this patient number 1 and see this patient number 2. By assessing a patient extraorally, the patient number 1 is an average profile. The patient is class 1 um, uh, straight profile, but the patient number 2 is an class 2 convex profile. So you should put in mind that the patient number 2 may need extraction to correct this open bite that is present, and this patient number 1 by her profile may not need to extraction to correct her bite. So you should another way to correct this problem. As shown here, this is an Rickettsia line, and the upper and lower lips in relation to Rickettsia line is normal and average. And this patient number 2, when we draw this line, upper and lower lips are protruded. So you should put in mind and put into consideration the extraction of the teeth in the patient number 2 is maybe an method to correct this problem. So you consider extraction in this case. Also, there is 2 patient extraoral photos give me an indication for the treatment modalities of open bite. This is patient number 1. When she smiled, she has decreased the incisal show, and this patient number 2 has average incisal show or may be increased. So when you see this patient number 1, we can consider extrusion of the upper incisors because the patient has decreased the incisal show. And the patient number 2, you should avoid the extrusion of the upper incisors, because if we go for this extrusion, the patient smile become gummy smile. So the case get worse. So decrease the incisal show in the patient number 1, increase the incisal show in the patient number 2. Why lateral calf? This is 2 lateral calf of the 2 patient. Patient number 1 had average incisor inclination in relation to their bases, and the patient number 2 has proclined upper and lower incisors. So you should put in mind that the patient number 2 may consider extraction of this case to correct the open bite. So summary for the previous slides: you should assess a habit if it is present or not. The way of respiration, you should consider a normal or abnormal. Sticking out if the teeth proclined or normal. Incisal show or lip line if it is decreased or increased. And you make a marks like this. So the patient have habit, you should refer the patient to a specialist or put into consideration using some removable appliance that used to control the habit. The way of respiration also, if it's abnormal, you should put in mind that refer the patient to a specialist to confirm the patency of the respiration. And the sticking out, if the patient has proclined, you should consider extraction in your treatment plan. And incisor show or lip line, if it is decreased, you can consider extrusion of the upper incisors, and this may improve the smile of the patient. So I am ready to start with the patient. So let's start the treatment, but before you start, you should take the consent. It's very, very important. So treatment of open bite cases in brief: the open bite confined to anterior only. If the open bite is extended more than anterior teeth and extend to the posterior teeth, you should put in mind that 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 case is considered skeletal. So this is not our treatment goals and our treatment model. So we confine to the anterior teeth. That open bite that is confined to anterior teeth, so it is considered dental. So this is what I say here in this slide. The first of all is the age of the patient. If the patient is a child, you should assess the habit is present or not, and you should consider stopping the habit. And we can discuss this section in details after in another webinar, but today we discuss the adult patient. This adult patient, you should consider the habit, as I said before. Consider stopping the habit. If it is sticking out, you should consider extraction. If no sticking out or sticking out present and there is spacing, you should consider two treatment lines: extrusion of the anterior, intrusion of the posterior. Extrusion of the anterior in cases of habit present and low smile line, and intrusion of the posterior in case of habit present and high smile line. So this is case number 1. AS is 18, male patient come to my clinic complaining from disability to meet the teeth together, and the patient has an open bite which about 5 millimeter, and the patient has class 2 incisor relationship, and the patient has proclined upper and lower incisor. The patient has average incisal show or maybe slightly increased. So our treatment goes to the patient first has habit, which is an tongue thrust. So I consider putting tongue thrust habit breaker, which is tongue guard in my appliance. And then after using tongue guard, I decided to make intrusion of the posterior teeth by acrylic cap in the posterior teeth and using a mini screw in the buccal side. And this acrylic capping has two arms that is attached to the power chain. After progresses of the treatment, the open bite closed slightly, and then after that closed completely, then remove the appliance, and then it's still in progress, and after that we will bond full arch upper and lower, and closing the upper right spaces and upper left spaces, and this give me also deepening of the bite more and more, and correct the inclination of the proclined upper incisor. This is design of the appliance. The design of the appliance have an tongue guard which is present in the rouget area, and this also have TBA in the roof of the mouth, and this is acrylic cap which cover the posterior teeth and have two arms to applicate the forces on it. Case number 2, 20 years old female patient came to my clinic, suffer she can't open the ketchup. The patient has open bite confined to anterior teeth. The patient has decreased incisal show and average inclination upper and lower teeth. This is panoramic X-ray for the patient, and this is cast study model for the of this patient. I decide to go for also intrusion of the posterior teeth to corrected open bite anteriorly according to evidence that the intrusion of the posterior is more stable than extrusion of the anterior. So I decided to go for intrusion of the posterior teeth by technique like the previous case, but have an change in the arm and the acrylic cap unlike this. So I'll discuss this in details after in the next slide. This open bite closed slightly and then closed completely in the visit number 10. So this open bite closed completely, and this design of this appliance have an arm that is rested in the occlusal surface of the buccal segment, which extend to from 4, 5 and 7, and have TPA to avoid the buccal rolling of the upper posterior teeth, because the force of application is a buccal to center of resistance of the sexes. The third type of open bite is bimaxillary cases, which have proclined upper and lower incisor in relation to their bases. This is case SSS 24 female patient came to my clinic complaining from her bite, and this patient, when you assess the patient from lateral view, profile smile and lateral cuff, you conclude that the patient has proclined upper and lower incisor and moderate crowding in upper and lower arch. So I decided here to extract upper and lower fours to correct the inclination of the upper incisors and correct the inclination and correct the crowding. After removing the upper and lower four and using and reinforcing the anchorage in the upper arch, and then after that closing all the spaces, and this open bite closed completely, and the patient corrected finally by extraction upper and lower fours. So the profile and the smile of the patient improved too much after the treatment finished. Hope to be useful for all. Thank you very much. Nice to meet you in the next time.